I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respect to elders past and present. I'd also like to acknowledge and thank AbbVie for providing us with the funding to deliver this project. The focus of this webinar will be on fear of cancer recurrence. We have three incredible presenters who are going to share some valuable information with you. If you have a particular question, please call the Ovarian Cancer Australia Information and Support Line on 1300 660 334. This webinar is being recorded live and will be posted on the OCA website. If you're having trouble with the sound, you can dial the 1800 number listed in the chat box. So I'm extremely privileged to introduce our presenters to you. Our first presenter is Dr. Maria Ftanou. Dr. Ftanou is the head of the Clinical Psychology Department at the Peter MacCallum Cancer Centre in Melbourne and a research fellow at the School of Population and Global Health at the University of Melbourne. Maria has over 17 years of clinical experience, primarily in the field of psychosocial oncology. Dr. Ftanou will talk about what this anxiety around fear of recurrence is, when it may arise, and some techniques to help manage the fear. Our second presenter is Dr. Ben Smith. Dr. Smith is a Postdoctoral Fellow at the Centre for Oncology Education and Research Translation, the Ingham Institute and the University of New South Wales. Dr. Smith will talk about the latest research regarding the impact and management of fear of recurrence in people affected by ovarian cancer and cancer more generally. And our third presenter is Jan Antony. Jan is a 74-year-old lady who was diagnosed with stage 3 ovarian cancer in 2008 and has survived despite the cancer returning 3 times. She's been cancer-free for the last 4.5 years and shares her experiences and thoughts on what works for her when the fears of recurrence surface. So I'd like to now hand over to our first speaker, Dr. Maria Ftanou.
Thank you, Vanessa, for the invitation. I'm delighted to be speaking to you today about fear of cancer recurrence and also to be speaking with Ben and Jan. So today, my talk's going to cover we're going to look at what is fear of cancer recurrence. We're going to discuss some of the impacts that fear of cancer recurrence has on people's lives, and then we're going to look at some tools that may help better manage fear of cancer recurrence. So when treatment is over, there is an expectation for people to go home and start to feel positive and get back to normal. For many people, however, this is not the case. Of course, people are relieved that cancer and its cancer treatments are over and they don't have to go through the exhausting treatment regime. However, cancer has ongoing and lasting effects. So once you finish treatment, the cancer continues to impact on your physical recovery, on your identity. You've gone from being a well person to being unwell to now not quite sure which side to stand on. It impacts on your social networks and your ability to go back to work, on your intimate relationships. It causes fear of maybe perhaps life might not be as long as one had expected it to be. It impacts on your body image and on your emotions. People often feel once they're finished treatment, there is a sense of relief, but also that they might also feel abandoned by their medical teams and not being monitored carefully anymore, and this causes anxiety about being left alone to manage after treatment and manage whether and monitoring your body. So people often feel a bit frightened at this point, and when they're finished treatment, new thoughts start to emerge. At the beginning, the thoughts were like, let's get together and fight this and beat this and come to at the end of treatment. People start to question whether they've done enough, whether the treatment has worked. So how long will the treatment work? Will they ever have to go through this again? And these kind of thoughts are often what leads to fear of cancer recurrence. Fear of cancer recurrence is one of the most common symptoms after finishing treatment. And fear of cancer recurrence has been defined as the fear or worry the cancer could return or progress in the same part or another part of the body. It affects both people with curative disease and people with more metastatic and progressive disease. It is one of the most common unmet needs in people with cancer, and by that we mean that people kind of say, we really need help with this, and we're not addressing it we're not addressing it adequately. So it continues to be a need. And then also this fear of cancer recurrence has also been found to be persistent in many people as well. So even there's studies that's revealed that 1 in 3 people, even 10 years post-cancer diagnosis and treatment, often experience fear of cancer recurrence. This fear can take many different forms. Some people's fear is about being really worried that if the cancer comes back that they will die from it, and so they're fearing of death and how their death may impact on others or how they will die, will it be painful. For other people, it's about fear of further treatments, like not wanting to go through further chemotherapy, radiotherapy, and feeling all the side effects of these treatments, or worried that they'll be suffering from these treatments and feeling disabled by some of these treatments or loss of further independence. So that for other people, it's the fear of not being able to fulfill obligations, and that might be raising your children or fulfilling your commitments to your family and the ones you love. Fear of cancer recurrent is, as I said, is quite prevalent. And it can range from mild to severe. The ranges, because of the way we've measured fear of cancer recurrence, are quite large, and our definitions of it in the literature. But in general, up to 97% of people have been found to experience a degree of fear of cancer recurrence. 22 to 87%, with an average of 50%, have been found to experience moderate to high levels of fear of cancer recurrence. From 0 to 15%, with an average of 10%, have been found to experience high levels of fear of cancer recurrence. The characteristics of fear of cancer recurrence manifests because people have a strong conviction that their cancer will definitely come back. It often involves constant and intrusive thoughts and worries and ruminations about the cancer. So you might be out with your family, your friends, doing something that you love, and there it pops in, and the thought pops in. It's, oh my gosh, it's going to come back, and it's intrusive and intrudes on all these on the special occasions. It intrudes in your sleep, and people develop a hypervigilance to physical symptoms. They're always on watch for a physical symptom or any changes in their body. For some people, fear of cancer recurrent leads to avoidance of medical appointments, screening, self-checking and monitoring. For others, it leads to excessive levels of symptom checking and screening. And by that, that might mean asking your physicians for increased scans, calling up your GP, having increased medical appointments to make sure that you're safe, and also increased naturopathic appointments as well. So at severe levels, fear of cancer recurrence interferes with your daily functioning. You're unable to concentrate. You're unable to do the things that you love. Spend time with your family and friends. You're not present to those interactions, and it is often associated with distress, increased levels of anxiety, increased levels of physical symptoms, depression, and a lower quality of life. There's lots of personal descriptions in the literature, and I'm sure that you'll have your own wording for what it feels like. But people often describe it as feeling stuck, feeling stuck, too scared to live and too scared to die, feeling that life has stalled, been put on hold, with no way of knowing how to get started or move forward again. That kind of constantly waiting for the shoe to either drop, for something bad to happen. And I like this last description that I've got on the screen, where you're worried about all the symptoms. It could be gas pain or it could be cancer. Some people are more at risk than others for experiencing fear of cancer recurrence, and people who are younger are more at risk because it's not something that they've expected to have in their life. Cancer is often experienced by people that are older. People with a past traumatic history or general levels of anxiety or anxiety disorders. If you've had some kind of past trauma, you're more attuned to look out for danger. Females are more likely to experience fear of cancer recurrence. And there's also people who irrespective of their level of risk, have a high subjective risk perception. They strongly believe that their cancer will come back. And if you've got ongoing physical symptoms or experiencing severe side effects, it's often a reminder that something else is going on in your body and often triggers fear of cancer recurrence. Another risk factor is being dissatisfied with your medical team and your treatment. This often leads to a fear of cancer recurrence because you often feel that you haven't gotten the best treatment for yourself, and you have to keep monitoring, and you feel that you're at risk. There are also some triggers that lead to fear of cancer recurrence that you need to be aware of. So around follow-up appointments and scans, it's often a time that I see people with increased levels of fear of cancer recurrence. If you've noticed a new or ongoing physical symptoms, anniversary dates, often anxiety and fears peak because you're often taken back to the point of being first diagnosed. Every time you hear about a new celebrity's diagnosis or battle with cancer or a media story, it often triggers your own thoughts and fears and people's own experiences of cancer. People are very genuinely sharing their experiences of cancer and stories about cancer. And usually these stories are not stories that people do well in. And if you're often hearing these stories, you're more likely to be triggered, and your own fears are often likely to be triggered. So, how do you live? How do you live better with fear of cancer recurrence? So our aim of our treatments and our toolbox is not to get rid of the fear. For some people, it is very likely that their cancer will come back. But what our aim of treatments and strategies, and Ben will talk later on about some of the more evidence-based treatments, it's about learning to live well with the fear and learning to manage it so it doesn't interfere with the things that you love to do and your relationship. So I love this quote by John Kabat-Zinn. You can't stop the waves from coming, but you can learn to surf. So our toolbox is about teaching you to surf. So the first step in learning to manage fear of cancer recurrence is to practice good self-care. And self-care is the intentional activities that you do on a daily basis to look after yourself, to take good care of yourself, to refuel. And it's not something to be added to a to-do list. It's a commitment that you make to yourself. And good self-care begins with investing in your supportive relationship. Seeing the people that you love, that you care about, that boost you, that fill you, that inspire you, and avoiding the people in our lives, we've all got them, that we feel obligated to see or that, are quite negative around us. So avoid some of those interactions and invest more in the interactions and people that make you feel good and that you love being around. Looking after your physical health is very important, and I know that you've probably heard lots about exercise and nutrition. Exercise is hugely important, and the recommended levels of exercise are about 30 minutes a day, and exercise that leaves you a little bit breathless. So it's kind of been described, instead of taking your Chihuahua for a walk, taking your little German Shepherd, your German Shepherd for a walk. So it leaves you a little bit breathless. Good nutrition, making sure that you go to sleep when you're tired, wake up at the same time every day, practice good sleep hygiene, and invest in a good GP that is willing to listen to your physical symptoms as well as your emotional symptoms. Another hugely important thing to do when you're looking after yourself is to really be aware and reflective about your own resources. After cancer treatment, you're exhausted and tired. You're going to need to be able to say no to some of those things you don't want to do and break down tasks to make them manageable and doable. If you want to don't clean out the whole house, clean out one bedroom, clean up one drawer, break tasks down. Find things that are meaningful and give you pleasure. It could be a walk in the park, it could be playing with your dog, it could be learning to sing or play a musical instrument, it could be spending time with people that you love. Find what is meaningful to you and do it frequently. Here are some activities that, just in case people, because we often stop doing the things we love when we're quite stressed, here are some activities that you might invest in. Doing gratitude lists, going out for a nice meal, spending time in the garden, Do what is meaningful and gives value to your life. Communication with your treating team is essential to managing your fear of cancer recurrence. You need to be clear with your treating teams about the kind of information that you like to receive and how you'd like to receive it. For some of us love information. Some of us feel empowered by information and we want lots of it. We want to know every single bit of detail. Ask for that information and tell your treating team that that is how you work best, with having this information at hand. For others, some of us don't like information at all. It makes us anxious and we feel overwhelmed. Tell your treating team that you don't like that much information and you need to only be told certain things. But good questions to ask your treating team. Ask them about what their surveillance recommendations are. How often should you be checking? How often should you have scans? How would these appointments be arranged? And then ask them questions of like, if you notice a symptom, how long do you need to wait before you do something about a symptom? Can you wait a week? Can you wait 2 days? Or do you need to, or can you wait 2 weeks? What are the risks of waiting? Also ask your team about when you go for scans, how long will you need to wait for results? Is it normal to wait 2 weeks? Or will you get a call the next day? Or when will you get called in? Also find out from your treating team, who do you go to when you have questions about your physical symptoms, your side effects, if you notice something new into your body, do you go to your nurse? Do you go to your GP? Do you go to your medical oncologist? And what is the best way to communicate with them? Is it to call and leave a message with the receptionist and they will guarantee to get back to you? Or is it to send an email? And how quickly does your medical team get back to you? Do you have to wait 2 days, or do you have to wait, a week? What is the best way to get information? And if they're not available, who do you go to? What kind of questions do you go to your GP with, and what kind of questions do you go to your medical oncology team with, or your cancer team? You might have heard a lot about cognitive behaviour therapy, or it might be the very first time. But cognitive behaviour therapy is often used to explain fear of cancer recurrence and to help with the thinking around your thoughts that might exacerbate your fear of cancer recurrence. So this is the brief model of fear of cancer, a brief model of CBT. So what it basically, the model states is that your thoughts will impact on your feelings and behaviours and vice versa. So if you have a thought, oh my gosh, my cancer's come back or it's progressed, it's going to impact on how you feel and your behaviour. So my next slide will give you a bit of an example. So we start up the top here. If you've noticed a physical symptom and you've gone, oh my God, it's back, I'm not going to be able to handle this, this is a disaster. If that's the first thought you've had, you're going to end up feeling quite overwhelmed, anxious, scared. You're going to end up either checking your body or being hypervigilant, or going, I'm going to avoid this and not do anything about it. But whatever these behaviours that you choose to do at that point, it's probably going to leave you a bit breathless, shortness of breath and anxious, and you're probably going to experience more muscle tension, and it's going to become a little bit of a vicious circle. Other thoughts that often get us in trouble with fear of cancer recurrence are our thoughts about worry in itself. Many of us have a relationship with our worrying thoughts. So some of us believe that if we worry and we get told, if we worry and we get told that our cancer has progressed or reoccurred, that we'll be better prepared to manage it. In my experience, working with people with cancer for quite a number of years now, people, even if the news is bad, people are never prepared for it. You react in a different way. So a rule about worry is worry when you can do something about it. If you can change something, then worry about it. For other people, they have relationships with worry that exacerbates fear of cancer recurrence, in that they believe that worry is harmful or making them sick. And so they start, as soon as they notice a worrying thought, they start panicking about it because they believe that they are creating their cancer to return or fulfilling a self-fulfilling prophecy that now they're going to make their cancer come back. There is no evidence that worry in itself causes your cancer to come back or return or progress, but it does make you feel very stressed and uncomfortable. So what can we do about worrying thoughts? We can start to reframe them. And some good questions to ask yourself when you're getting into that spiral is, are you confusing a thought with a fact? Are you predicting the worst possible situation, jumping to a conclusion? Are you minimizing any of the positives that are happening right now? What are the advantages of you continuing to think that your cancer is coming back? Are there any disadvantages to these kind of thoughts? Are you only paying attention to the dark side of things at this point because you've gotten caught up in this ruminative thinking? And the one I really love there, if a friend was going through these kind of thinking at the moment, what would you say to them? And try and apply that kind of thinking to yourself. Another way that you can deal with some of these ruminations and thoughts is through practicing acceptance. Accepting that you have these thoughts and feelings at the moment, and then you're feeling quite anxious and you're feeling, and the thoughts are running through your mind, but knowing that these thoughts will pass too, and these feelings will also pass. So don't judge them, just label them perhaps and say, oh, I'm experiencing these fear of cancer recurrent thoughts again, and they're intrusive. So you could label them, but not get caught up in them. And some useful metaphors to kind of think of it is like clouds in the sky. So imagine your thoughts like clouds in the sky that are going to pass over soon. They might stick around a bit longer than you're comfortable with, but they will pass. Or think of your thoughts as that you're a passenger at Flinders Street Station and you're watching the trains go by, and they're your fear of cancer recurrence thoughts. You don't have to hop on those trains. You can just watch them and wait for the thought you want to hop on and invest in that. You don't have to get caught up with those thoughts. Or again, another one is imagining your thoughts as leaves on a river stream floating by. You can just watch your thoughts go by and not get engaged with them. Mindfulness is another very useful strategy to help with managing fear of cancer recurrence. And by mindfulness, mindfulness has been defined as the mean as paying attention in a particular way on purpose and being in the present moment and non-being judgmental, being kind of just noticing what's going on and not being judgmental about yourself, your thoughts and your feelings. So a usual technique with mindfulness is to focus on a particular object, to train your mind perhaps to focus on your breath or sound. But we traditionally focus on the breath because the breath is aware of how we're feeling a lot of the time. So that's why we tend to focus on the breath. When we're excited, our breath changes. When we're sad, our breath changes again. When we're angry. So that's why we focus on the breath, because it's really connected to our emotions. So when you practice mindfulness, you'll do lots of breathing exercises, and your mind will often wander. And to bring it back to the present moment, you've got to bring it back to the breath. You do this once, you do this twice. You might be required to bring your mind back to the breath 1,000. Your mind might travel from the breath 1,000 times, and 1,001 times you need to bring your mind back to the breath. So this kind of mind training helps you to be in the present moment, to be more responsive rather than reactive to situations. And there are lots of mindfulness groups around Melbourne and apps that you can, in Australia, that you can use. One of the ones I highly recommend to people is the Open Ground. The Open Ground classes, and they do them online, and they also do them face-to-face, and they're across Australia. And another good mindfulness website and app is the Smiling Mind one. And I've got those links down the bottom of that slide. It is also, to manage your fear of cancer recurrence, is to stay focused on the task at hand, being present at what you're doing in the moment, and not not going too far ahead. And I love this quote by Jimmy Holland, and I'm just going to read that out for you. The diagnosis of cancer and its treatments creates a sense of urgency about time that goes along with the uncertainty it causes. However, the person who can say, I'm just going to take it one day at a time, is able to stay focused on the task of the day. The person who hardly enjoys today because of concerns and worries about tomorrow has a much harder time dealing with the illness. Hard as it is to keep thinking that way, coping with cancer is easier if you try not to focus on all the challenges that may lay ahead, but rather stay focused on today, during which you can accomplish something despite the problems. And just if some of us, if you're really struggling, might need some professional help. So speak with your GP, attend support groups like this, speak to your oncologist, and seek referrals to a psychologist. And this is the APS website and link, and you can find psychologists on this site from across Australia. So I always love to end with this slide because it's a little bit fun, but it also tells us a little bit about some commandments of how to look after yourself, and everyone should print them out and stick them on their fridge, and it's about really taking care of yourself. So the first commandment is try not to be perfect. Don't even try. You shall not be perfect. Try not to be all things to all people. Leave things undone that ought to be done. Try not to spread yourself too thin. Learn to say no. Schedule time for yourself. Switch off and do nothing regularly. Be boring, untidy, inelegant, and unattractive at times. Try not to feel guilty, and especially don't be your own worst enemy, but try and be compassionate and kind and be your own best friend. Thank you for listening to me today, and I hope you found some useful tools that you will use for managing your own fear of cancer recurrence. Handing over to Vanessa now.
Thank you so much, Dr. Ftanou, for providing us with that valuable information. It's much appreciated. We've just got one question for you. What can I do to manage my surge of fear in the moment?
I think it's when you notice that surge of fear come on, I think it's about stopping and noticing it and just labeling it. It's saying, oh, I've noticed that I'm experiencing this fear, and thinking about it and not reacting to it, not trying to get caught up in it, and thinking about perhaps using one of those metaphors that I described earlier about watching your thoughts float in the cloud like a cloud that it's going, this thought too will pass, or this fear will not last, and I'll be able to cope again. Just noticing the symptoms. Thank you.
Great, thank you very much. Thanks again for joining us on this webinar. So I'd now like to hand over to our next speaker, Dr. Ben Smith. Over to you, Ben.
Thanks, Vanessa. And thanks for having me along to talk to everybody about fear of cancer recurrence and what we can learn from the latest research. Maria and I have actually worked together on some studies to try and help people manage their fear of cancer recurrence. So there will be a little bit of overlap between our presentations. So I apologise for that, but hopefully, although I managed to be quite boring, inelegant, and untidy in helping me reduce my stress in real life, that'll be less of the case today. But so Maria has already run through what fear of cancer recurrence is. So I won't go into the definitions, but one thing I do want to emphasize is that fear of cancer recurrence is a very normal experience for anybody affected by cancer. We know from a big review of more than 100 studies that have happened on this topic that at least half of people experience moderate to high levels of fear of cancer recurrence that are likely to cause distress and have an impact on their daily life. So this is a very common phenomenon. So if you're experiencing fear of cancer recurrence, please don't feel like you're the only one. It's a very normal thing to have after cancer. Having a little bit of a problem with the slides, but here we go. So that previous chart that I showed you was of fear of cancer recurrence, people affected by cancer generally. This one pertains to fear of cancer recurrence in women who have had ovarian cancer in particular. So it's estimated that anywhere between 1 in 5 and 4 in 5 women who have had ovarian cancer experience fear of cancer recurrence. And the reason why there's such a big range of estimates there is because there's different ways we measure fear of cancer recurrence. But I think this chart is quite useful in showing what how often people think about this. You can see that these are people who have been cancer-free for about 7 years, and there are a reasonable portion of people, about a third, who do think about cancer coming back very little, which is great. But we then see that even 7 years post having their cancer, there are still about a quarter of people who are thinking about their cancer coming back weekly, and about 10% for whom it's a daily concern. I think another important point to make is that fear of cancer recurrence doesn't just affect the person directly affected by cancer. It's very common in caregivers as well, and some studies have shown that it's actually more common in caregivers, perhaps because carers are a bit reluctant to express their concerns to the person directly affected by cancer. So if there are any carers tuning in today, I hope that you feel that, that some degree of acknowledgement that this can be an issue for you too. And Ovarian Cancer Australia actually has some resources specifically for carers. And this is an example of a webinar that was put in pertaining to carers a couple of years ago. So I think it's often assumed that fear of cancer recurrence will reduce over time, that as people move on from finishing treatment, their concerns about their cancer coming back will reduce. But what we actually know from the literature is that fear of cancer recurrence left untreated or unmanaged is very common continues over time. So you can see from this study, which included about more than 100 gynecological cancer survivors, more than half of whom were ovarian cancer survivors, there's this group of about half of those women who are experiencing high and stable levels of fear of cancer. We know that in this group, they're more likely to be women who are Caucasian and have advanced disease, and that heightened fear is associated with increased levels of depression and cancer distress, but it's also worryingly associated with lower people expressing their concerns to others less, and having a lower amount of degree of self-efficacy or belief in their ability to cope with managing those concerns. I think this is really worrying, because if you don't think you can cope yourself with your concerns, but you're also not expressing them to other people to try and get support, then you're likely to suffer from much worse outcomes. So I'd encourage anybody who's struggling with these concerns to, what we can learn from this is sharing your concerns with people is better, and that's particularly important if you don't think you're able to manage them on your own. So we know there are a few other risk factors for fear of cancer recurrence. It seems like in women with ovarian cancer in particular, the time around finishing active treatment is, and what I mean by that is well, most commonly chemotherapy, I guess, and also the time when you're coming up to follow-up tests or appointments. That's a really stressful time as well. In people with cancer generally, Maria's already covered some of this, but people who are younger experience physical symptoms and are generally anxious are also more likely to experience fear of cancer. So I think when it comes to finishing active treatment, as Maria said, I think there's a lot of people often assume that that's a great time. People are finished their treatment, they can move on now. Their cancer is, they've dealt with their cancer, but but a lot of people actually find this a really scary time because they're not doing anything to actively fight it, as shown by this quote. So, you know, it's really important to know that this is a common experience, and I'll give a few tips on how to deal with it a bit later. And again, with follow-up tests and appointments, another really stressful time where people are very anxious leading up to their appointment. And again, I'll run through a few tips to manage that. So, yeah, in terms of managing that, those fears that tend to pop up before having follow-up tests or appointments, as Maria said, I think it's important not to beat yourself up too much. And although beliefs about worry can negatively impact or exacerbate fear of cancer recurrence, I think in the short term, in these particularly stressful time periods like before follow-up appointments, it's okay to worry. Don't beat yourself up about it. And as Maria said, there is really very weak evidence or a lot more studies showing no link between stress and cancer than there are studies showing a link. It might help if you help to plan something nice in the days leading up to your appointment, just to take your mind off things a bit, and also share your concerns with others. As I said, there's evidence that if you don't share your concerns, you're actually more likely to have high fear of cancer recurrence. So share it with your friends and family, trusted loved ones, and that'll help reduce that burden. You can also use techniques that Maria alluded to, like thinking about those worries as like passing clouds in the sky, or trains at a station that you don't have to engage with, and you can just let pass by. But if you do continue to worry about your cancer coming back after your appointment, it's probably a good idea to go and seek some professional help. So it's really important that we address fear of cancer recurrence, because it, you know, in addition to the fear itself, it's also associated with a lot of really horrible outcomes, like even symptoms that are a bit similar to post-traumatic stress disorder, and a general sense of hopelessness. So it's important that we address this concern, and I'll talk a little bit about what has been done to try and manage fear of cancer recurrence. So before I do that, this is just reiterating that fears about cancer coming back are really common in women with ovarian cancer in particular. And if we think of it, you can see here in this study where there were 50 women included, 30 or more, their top concern was fears about the cancer coming back. And about 50% of those are experiencing high levels of stress associated with that concern and wanting more help to deal with it. So what treatments are there for fear of cancer recurrence and ovarian cancer? Well, to date, there's only been one study that's looked at a treatment for fear of cancer. Well, a treatment that has addressed fear of cancer recurrence to some degree. It's not really specifically focused on it. And I'm just going to talk through this study now. So it included 352 women with gynecological cancer, almost 2/3 of whom had ovarian cancer, and they were recruited less than 6 months post-diagnosis, so fairly close to their experience with diagnosis. And so the main intervention that these investigators were testing was an intervention that aimed to teach people coping skills and communication skills. So really teaching a lot of the strategies that Maria has mentioned, and also helping them communicate with both the healthcare team and their friends and family. Consisted of 8 sessions, only one of which was really focused on fear of cancer recurrence specifically. I mean, it was really an intervention aimed at addressing psychological concerns in ovarian cancer, women with ovarian cancer generally. There was also, so there were actually 3 arms to this. The second arm was a supportive counselling intervention where people had time with a psychologist, but they weren't taught any active coping skills. Instead, that the psychologist was directed just to provide empathy and support. And then there was a usual care arm where people got the standard kind of consultations with the social worker, and then also were referred to the psychologist. And the treatment seemed to be pretty well accepted by patients, with more than 80% attending all sessions. And here are the results. Apologies that the graphs are a little bit hard to read, but this is showing a number of different outcomes. Fear of cancer recurrence is down here, and I'll talk about that in more detail in a second. But the solid line here represents the coping and communication skills training. And this is looking at, so you can see that over time, out to 18 months, there was a significant decrease in depression. And then there's also a drop in distress, and this is emotional well-being here. So there's a small rise in emotional well-being, but when we look at the fear of cancer recurrence outcome, so just enlarged here, what you see is after an initial drop out to 6 months, it actually increases a bit, again, back to the same kind of levels we saw in the beginning, and this drop is actually very small. Graph here. So there was no real, unfortunately, this intervention didn't really impact on fear of cancer recurrence. And interestingly, there was no association seen between fear of cancer recurrence and problem-solving coping. So it suggests that fear of cancer recurrence isn't necessarily an issue that can just be problem solved away. It's not. I mean, because it is possible for some people that cancer will come back. It's not something where we can just say, don't worry about that. So I'm going to talk a little bit more now about the treatment that we've come up with for fear of cancer recurrence, which is called Conquer Fear. And the difference, I suppose, between this treatment and some of the others that have been trialled is that it's not aiming to get rid of or eliminate fear of cancer recurrence. It's actually trying to help people live better with that concern. And I'll just talk through the model briefly, but on the left-hand side here, this is, I suppose, the experience that many people go through after cancer. The diagnosis and treatment is a very stressful and distressing experience. That causes people to experience a stress response, which might consist of intrusive thoughts about the cancer coming back, or lots of self-checking for the signs that the cancer might be coming back. But over time, a lot of people do manage to establish a new kind of normal or sense of normality. But it's the people who have unhelpful beliefs about worry who we think are most likely to develop higher levels of fear of cancer. So those beliefs might take the form of positive beliefs about worry. So thinking that if they worry a lot about the cancer, that they'll be more prepared if they have a recurrence. Or they could be negative beliefs about the danger or uncontrollability of worry. As Maria said, thinking that their worry might actually cause a recurrence of the cancer. So what this causes is a really heightened perception of threat, and also a lot of self-focused attention. This is what leads to things like the misinterpretation of symptoms as being signs of the cancer coming back. And this can cause heightened fear of cancer recurrence, which causes people to worry more, to check more, and that increased worry leads them to be either wallow in their worry or struggle against it, which then causes even more focus on the fear itself. So because so the Conquer Fear treatment aims to try and help people challenge those worries about their worry, and also direct less attention towards the cancer. These are just a couple of the skills that are taught. I won't go into them in detail, but basically, as I said, the main tenet of the therapy is to try and help people live better with the cancer, live a life that's more consistent with their values and less focused on worries about their cancer coming back. So these are the kind of headline results from the study. So the Conquer Fear intervention was compared with a relaxation training group, which was called Taking It Easy. So that's this top line here. Along this graph shows the fear of cancer recurrence level. So you can see that both groups, the relaxation training and the Conquer Fear intervention, improved over time, but that the reductions in fear of cancer recurrence were much greater in the Conquer Fear group, which suggests that it's a really effective intervention. So unfortunately, so the Conquer Fear intervention consisted of 5 sessions delivered by a trained, highly skilled therapist, but unfortunately not everybody has access to those people. They're typically based at large metropolitan cancer centres, so people living in more rural areas wouldn't have access, for example. And there's also a lot of people who prefer to manage on their own. So we're currently working on an online adaptation of face-to-face Conquer Fear, trying to increase access to fear of cancer recurrence treatment. Unfortunately, it's not currently designed for ovarian cancer sufferers in particular, but we are actually applying for a grant to adapt it for women with ovarian cancer. So perhaps in a year's time, if we're lucky, that'll be a resource that's available for ovarian cancer. And just in the meantime, though, the Ovarian Cancer Australia is developing a fear of cancer information sheet, which I'm very happy to be contributing to, and that will complement the resources that OCA already has, such as the Resilience Kit, which can help you manage some of these. Finally, I'd just like to thank everyone who's contributed to the work that I've just described, and thanks to Ovarian Cancer Australia for having me to talk to all the rest of you. And there's just a few references to finish if anybody wants to read more about any of this stuff. Thanks.
Thank you very much, Dr. Smith, for that unbelievable presentation. Really, really valuable. There's just a couple of questions that have popped up. One is, why do you think there's no difference between women or people with early stage versus advanced stage cancer in terms of their levels of fear of cancer recurrence?
Yeah, I think that even though I suppose the objective risk of a recurrence is higher for women with more advanced disease, what seems to be more important when it comes to fear of cancer recurrence is a person's subjective perception of that risk. And ultimately, we're still not certain which people, or we're not very good at predicting which people will experience recurrence. So, someone who's got only a 1 in 4 chance of experiencing recurrence might worry about it just as much as someone who's got a 1 in 2 chance, just because they see that as an increase, or their perception of that risk is that that's a high risk. So I think it's we can't. We should be, or we shouldn't assume that people with early stage disease don't have these concerns. I think it's really important that we look out for people with these concerns, irrespective of what stage.
Sure, thank you. I'm just reading another question. It's quite a long one. Basically, this lady's saying that she thinks about cancer every day. She can't help but not, but her oncologist tells her not to. So she's asking, is it unhealthy to think about cancer so often?
So as Maria said, I mean, obviously that's something which I imagine causes this person a lot of psychological distress, and so I suggest that she should perhaps talk to a psychologist about it. But it's not something that will increase the likelihood of her cancer coming back, or is bad for her physical well-being anyway. But it might be worse due to the psychological distress But it is, I mean, look, it's really, as she said, it's really hard not to. She shouldn't beat herself up about it.
Sure. There are a few questions coming through. We've got time for just one more. How much time do you think must pass before fear of cancer recurrence decreases or goes away?
Well, I don't think there's, I mean, I suppose a lot of people, or some people find it that over time their fears will reduce, and for a lot of people it's when they hit that 5-year mark. But there's not really a point at which we can say, oh, you shouldn't be worried about your cancer coming back anymore. So I think, and there's a lot of studies of people, 10 or more years post-treatment who are still experiencing concern. And I don't think that, we should be saying those people are time to stop now. The reality is that if you're still experiencing concerns at that point, there are probably, you should be thinking about some of the, or maybe try some of the strategies that have been mentioned today, or see someone about it. But it's okay to.
Great, thank you. And I'll just ask one more if you've got time, if that's okay. Do you think the lack of information about what causes ovarian cancer increases the likelihood of people experiencing a fear of recurrence?
Yeah, I think there's definitely a link there. Some of the other work that I've done has been in testicular cancer and helping men faced by that disease. And we see a similar story, that they, and I suppose those men are fortunate they have a better prognosis, and a lot of women with ovarian cancer, but they still worry about the cancer coming back, even though that's very unlikely, because they kind of feel, well, if I was unlucky enough to get the cancer in the first place and I have no idea why, what's to stop it from coming back? So I think, yeah, that does really feed into other cancer coming back. Yeah.
Thank you. We'll leave the questions there. Thank you so much, Dr. Smith, for your time. We really, really appreciate it. So I'm very privileged now to hand over to our third speaker, Ms. Jan Antony. Over to you, Jan.
Hi, Vanessa. I picked up an enormous amount. Thank you, Ben and Maria. It was very helpful to me too. Funnily enough, I'm practicing a lot of that now, which I've sort of stumbled across. To give you a little bit of my background, I was diagnosed in 2008 with stage 3 ovarian cancer. And the first few days were horrific, but 5 days later I was on the operating table and the surgeon and team were superb. Someone's just revving their car outside my house at the moment, sorry. The treatment was the usual pattern. The operation was followed by chemo. And I was fortunate enough to be included in a trial for Avastin, which is now included in the PBS. Things went great for 2 years. And then a tumour appeared in May 2009, and I was really sunk into despair. I had an operation to remove the tumour, and then a second round of chemo, and on I went. 2 years later, again in May, another tumour appeared, this time sitting on the liver, which was really scary. And again, I had an operation to remove the tumour and a section of the liver, but this time no chemo, thank God. 18 months later, November 13, and yet another tumour, and I had my 4th operation to remove it, but again no chemo. I'm happy to say it's now 10 years since I was first diagnosed, and almost 5 years since the last recurrence. So you should never lose hope. I always told my divine surgeon I wanted to be one of the little fish that swam through the net.
Line muted.
Very well and happy. I've got usual joint problems typical of people of my vintage, but everything else seems so trivial in comparison. I've yet to meet a cancer patient who doesn't have some fear of the cancer returning. As is so often the case with ovarian cancer, I had very few and seemingly innocuous symptoms, and the diagnosis came as a huge shock. The boogeyman actually did jump out of the dark, and therefore I have no confidence that he won't do so again in the future. It wiped out all feelings of complacency and left my life on a knife edge. As my surgeon says, the sword of Damocles hangs permanently over your head. I'm a very glass half full sort of person, but the diagnosis took me to depths of fear and despair I'd never known. And believe me, there was a lot of weeping and wailing and gnashing of teeth. I've got no magic bullet for getting rid of the fear of recurrence and can only say what worked for me, in the hope that you might pick up one or two suggestions that you might find useful. After the initial operation, my surgeon gave me very good advice the day I left hospital. He said, "Jan, I know you're sore, but on the first day home, I want you to get dressed and go out your front door. You'll probably only make it to the house next door, but the day after you might go 2 houses down, and before you know it, you'll be walking round the block. The important thing is to get back out there and to stop thinking and feeling like a patient." I followed his advice, and my friend actually took me to coffee on the way home from the hospital. And it was marvellous just sitting amongst people, and I loved being part of life again, even though a tired and sore one. The overall aim for me is to live life as fully and as normally as possible, knowing that I have cancer rather than living my life as a cancer patient. It's very easy to become obsessed with the illness, and the fear then is always with you. I was on the operating table 5 days after being diagnosed, but funnily enough, I felt much better after the operation because the cancer was now defined and a plan could be made to get rid of it. I firmly believe knowledge is power, as it gives you a feeling of being in control, and this lessens the fear. I always go to my medical appointments armed with questions. It makes me feel more like a general marshalling the troops, rather than a victim being attacked by an invisible malignancy where the fear is ruling. Ovarian Cancer Australia is a fabulous source for reliable information, and I strongly recommend becoming very au fait with the website. And if you haven't already done so, get them to send you a copy of Resilience, their book for patients, which pretty much covers all the information you could need. And they also conduct information sessions where you can, for example, learn what is currently happening in research and treatment, which gives you hope for treatments in the future if your cancer does return. So make sure you get on their mailing list. Being fit and healthy obviously improves your immune system, and the fitter and stronger you are, the better you feel and the less you fear. I'm not obsessive and just make sure I eat lots of fruit and vegetables and generally healthy food, though I'm not vegetarian. Ovarian cancer referred me to a physio who runs exercise programs for cancer patients, and that was very helpful in getting fitter, and it was tailored to my needs. I'm no gym baby, but neither were the others, and that was okay. And one of my favourite ways of exercising is to walk Mr. Darcy, my faithful hound. Walking through trees in a park or along the beach with dogs bounding around is my idea of bliss, but to each their own. It's nearly impossible to totally eradicate all fear of cancer coming back, but I found several things very helpful in diverting the thoughts, and Maria picked up on this before. One is meditation, and it's very similar, in fact, to what she's saying, because I practice a very simple form where I sit quietly and slowly breathe in and out and concentrate on the breathing. And it's amazing how still you become. And when the thoughts come in, as they always do, I don't pretend they're not there. I just let them come in and let them slide across and out without thinking about them, a bit like the trains or the clouds. It does take practice, but it gets easier every time. There are many forms of meditation, and I suggest you find one that you feel comfortable with. I'm going to look up the site she gave us on the Mindfulness. As I always say, yesterday is history, tomorrow is a mystery. All we have is now, so live for the day. I also see a master acupuncturist and have done since I was first diagnosed. He's a miracle man, and I'm sure he's very much part of the reason I'm still here. There are many alternative therapies, but acupuncture works for me. But he's also helped me massively with reducing fear of remission and gave me this good advice, which I visualise often when I start to worry. He says, problems can be like little pebbles or big stones or huge boulders. Be like the river, he says. Flow round and over them. I met two fantastic ladies at chemo. They were so much fun. I used to look forward to going to chemo, and Deb used to bring champagne to the chemo session, saying we should celebrate as the drugs were fighting the cancer. As with my two chemo buddies, I culled my close circle down to those who loved life and made me laugh. Some of my old friends became terribly mournful and pessimistic about my future, and I'd come home feeling depressed. You need friends who can listen when you need to talk, but who replenish you rather than drain you. I cannot stress enough too the value of meeting like-minded women with ovarian cancer. It's not a club you want to belong to, but it's a huge relief to talk to others in the club who understand in a way that no one else can. My buddies and I met often and had fun and laughed, but we were also there for each other when the fear and the cancer came back in. Ovarian Cancer Australia can connect you with support groups, and I would strongly recommend this rather than soldiering on along alone. Family and friends are marvellous, but they don't get it like someone who's actually going through it. Another way to divert thoughts to more pleasant areas is to constantly plan rewards. For example, during chemo, I'd plan a walk on the beach with Mr. Darcy, or a relaxed dinner and a glass or two of wine with my family or close friends. And at the end of chemo, I'd plan something grand like a trip or a cruise. Or it could be something simple like spending a week with my family in Queensland. We're very close, and it's pure R&R to relax in their company. Large or small, it's so good to have something to look forward to and to plan for. I find I'm less likely to become fearful of the future if I'm doing things I enjoy. After my first chemo, I learned Italian and planned a trip to Italy. I'm currently writing a story of my life to pass to my daughter, and chasing up all the old photos and stories has been a great source of joy. And with all its ups and downs, and there's been ample mishaps, I feel it's been a life well lived. So find a project that interests you and absorbs you, and you have less time for morbid thoughts. The American psychiatrist Elizabeth Kubler-Ross says there are 5 stages of grief that are often worked through during the grieving process. They include denial, anger, bargaining, depression, and acceptance. It's very normal to work your way through these stages, and there's no set time to spend in any one of them. Unfortunately, some women can become stuck in the anger and depression phases, and it can make them dreadfully unhappy. If I was feeling really angry or deeply depressed for a period of time, I would certainly seek professional help to move on. You know, and then there's triggers. For me, the worst time were the appointments, as Maria and Ben both mentioned. As I no longer felt safe, it was always terrifying that the cancer might be lurking even though I had no symptoms. Once they took my blood, I couldn't sleep until I knew the results. But the fear can be triggered by an unexplained pain, an article in the media, a friend being diagnosed with cancer, or for no reason at all. When fear creeps into my room in the middle of the night, as it sometimes does, I use my meditation to calm my nerves, just again concentrating on slow breathing in and out till it passes. It doesn't always help, but most times with persistence, it shortens the time considerably. Although I'm a very positive person by nature, there have been times when I've been overwhelmed by fear and grief for all that I might lose if it comes back, particularly watching my much-loved daughter live her life. At such times, I don't even bother with meditation as I know it will be useless. I just let it rip. I lock myself away for a day, weep and wallow in self-pity, and I play Bob Dylan or Beethoven very loudly and drink wine. And it passes. I don't believe in bottling things in, and sometimes a good day's grief session helps me wash it all away and I get on. Mostly, however, I ensure my life is full of people I love and that I'm doing things I enjoy. The overall point, I think, is to focus on all that's good in your life and to fix what isn't where it's possible to do so. The women I've met on this journey have amazed me with their humour, bravery and optimism, which brings to mind Helen Reddy's famous song, "Oh yes, I am wise, but it's wisdom born of pain. Yes, I've paid the price, but look how much I've gained. If I have to, I can do anything. I am strong, I am invincible, I am woman." Thank you.
Well, thank you, Jan. What an incredible insight into your journey and your experience of living with ovarian cancer and your fear of recurrence. So thank you so much, just for being so open and honest about that. We've had quite a few questions come through, so I apologise if I'm not able to ask your particular question. But one is, what do you do to cope, anything specific that you do to cope in the lead up to checkups and receiving your test results?
I always make sure I have something that I really like doing just before. Usually it's having dinner with 3 really close friends who I know will let me whinge for a minute and then say, time up, that's over, let's have a drink. And I just find it just gives me a chance to express a little bit, and then we can relax. And it's just with the laughter, it just goes away. But I know it's going to be difficult, and I've just accepted that I've got to get through those few days and move on after that. Nothing's perfect.
Spot on. And do you believe that the worry gets less over time, as months pass and as years pass?
Oh yes, absolutely. If you ask me how I feel about recurrence now at the 10-year mark to how I was at the 1-year mark, there's no comparison. Yes, you do build, you personally, anyway, I can't speak for anybody else, but the fear has really gone down and down and down. Now I very rarely think about it. It's only if something pops up in the news.
That's great to hear, and obviously very encouraging for everybody on the webinar. So we might leave it there. We've gone over time already. I want to say a big thank you to you, Jan, for giving up your time and sharing your story with us. And like I said, just being so open and honest. I've had amazing feedback that I'll send to you, just for people chatting in the chat box, just saying how amazing you are and how inspiring you are. So thank you very, very much. So I just once again like to say a big thank you to our 3 speakers, Dr. Maria Ftanou, Dr. Ben Smith and Ms. Jan Antony. We really appreciate the information that you've shared and the time that you've given us today. Thank you everyone for being on the webinar. We really hope that you found it valuable. The recording of this webinar will be posted on the Ovarian Cancer Australia website over the coming weeks, and you will receive an email with a link to the recording in the next few days. If you have any other questions that weren't answered, like I said, apologies, we had a lot of questions come through, either about the webinar, including the Conquer study. I had a few questions specifically about that, or any other questions that you would like addressed, please don't hesitate to contact our information and support line on 1300 664 330. You can also email our support team at support@ovariancancer.net.au. In a moment, you'll be directed to an evaluation form. If you could just please take a moment to fill in that form, there it is there. It will just help us to plan and develop future webinars. So thanks again, everybody. We hope to see you for our next webinar, which will be in November. Have a great day. Goodbye.